We are entitled to health care. We should not allow anyone to determine who should have health care or who should have what kind of health care. We are entitled to be covered and insured.
Healthcare is a basic human right, not a privilege. It shouldn't be dependent on how much money you have.
It should be a human right. In this country, you're very lucky if you have it.
Healthcare is a right. Absolutely.
I believe this is the only country where poor people have to pay for health care. In all the other countries, everybody's afforded health care, whether you're working or you're not. If you lose your job, you don't lose your health care. Here, you get laid off, your health care goes.
The state says they have everyone's best interest at heart. Well, if the state has everybody's interest at heart, how come Mary Immaculate and St. John's closed?
The Healthcare Education Project is a joint venture of the Greater New York Hospitals Association and 1199 SEIU, United Healthcare Workers East.
We came together because we thought that it was important for the collective of artists and activists come together to address the healthcare issues that's happening right now in the United States. And here in New York City, even though we know that many of our political leaders are in favor of healthcare reform, that we still needed to have a voice on the issue. So we came together to create Young Voices Nation as a way to do civic education through the art, music, and poetry, because we believe that that is the way that people in our communities are best educated about the issues that impact them in their lives.
We already lost the only hospital that we had that serviced Community Board 12. The people who live up here used it. And now, guess what? They have no place to go.
I have two hospitals. I have a public hospital, Queens Hospital Center, where I used to chair the Community Advisory Board there. And our motto was, we care for everybody regardless of their ability to pay, regardless of their immigration status.
Because those hospitals were in the communities that they were in and they served the people that they served, even though the Berger Commission knew that those hospitals needed to stay open, they were closed.
It wasn't just the hospitals. See, a lot of places are just hospitals, just workplaces. We were like a family here.
The healthcare facilities in my district provide really good care, even though they are struggling. The money that would come out of them as a result of cuts, they're not coming out of thin air. You cut money, it means a staff person is going to have to get let go.
No, I didn't think I was going to retire from here. I wasn't going to leave Mary Immaculate.
And in light of the closing of Mary Immaculate Hospital, it and Queens Hospital Center are the only two hospitals, for all intents and purposes, serving Southeast Queens. Almost 1 million people. And then I have 5 nursing homes, including Margaret Tietz.
Cuts to the facility would more than likely mean a cut to my department. I would hope that the governor would see to cut other services that don't directly affect people's lives.
We have residents from different nursing homes. They've been here or they came here because their nursing homes are closed. So,
where would I go? I couldn't stay home because I'm by myself. Where would I go if it wasn't for here? I don't know what would happen. So I thank goodness for all the people here and that the place is here, you know.
This is their homes. This is what they're used to. These are the services and care that they need. And if you cut any department, any discipline, they're going to be affected tremendously.
You know, when Mayor Giuliani wanted to close Queens Hospital Center, or excuse me, he wanted to privatize it, but essentially close it off to people who don't have health insurance, we would say to people, if you may be healthy today, and you may feel you're not going to need this hospital, but one day you will, or someone you know will, and that will be too late to get up and come to a rally, or write a letter, or speak to your local elected official.
What we do best is go into our communities and help people to advocate for the health care that they deserve.
Healthcare is something that we're entitled to. The affordable, that's what we deserve. And what am I when I'm choosing between a fun-filled day with my children? Or do I say no, because if they get sick, I may not be able to afford the meds that will make them well. Open up your ears and open up your eyes, but most of all, open up your mouth, because this is reality that can change your community. Are you part of the millions that are uninsured, or do you have a premium that was just raised 97% in only 7 years? Because no jobs equal no coverage, and no coverage equals no life. So who's affected when the recession touches the pit of our soul? Just hope this poetry gave you a bit of reality. Now go make a stand, get involved, because this is your community.
Watch the company you keep, and the crowd is free.